Defer to Senator Baldwin.
Thank you, Mr. Chairman. I want to take the thread of what Senator Kim was just saying about the urgency of a parent caring for a child, and just note the moment that we're in right now in day 29 of a shutdown. And I thought you, Dr. Ramachandran, really helped bring out that the numbers of people that we're talking about who won't be able to afford their health insurance, and when they shop on Saturday, or when the opening period of shopping for Affordable Care Act marketplace plans, they're going to have a real shock. And I worry on both sides. I so support the biotechnology innovation that's going on across the country in my state. I want to talk about that with you, Mr. Crowley, in a moment. But we have an opportunity here to act, to bring some relief so that parents can afford to get health care for themselves and their children. And I just wanted to emphasize that. Now to the topic of today's hearing. Wisconsin is a national leader in biohealth, thanks to our investment in strong research institutions, advanced manufacturing, workforce training, and industry partnerships. According to the 2024 Wisconsin Biohealth Economic Impact Report, the industry supports about 141,000 jobs and generates over $37 billion in total annual economic impact. And because of the strong foundation in my state, in 2023, a consortium led by BioForward, a member of Bio, was selected as a regional tech hub focusing on personalized medicine and advancing the adoption of the next generation of theranostics. Mr. Crowley, in your testimony, you mentioned that each part of the biotech ecosystem is integrated and complex. And so I wonder if you could speak to the importance of funding programs like Wisconsin's Biotech Hub that deals with all of the ecosystem parts.
It does. Thank you, Senator. Again, Wisconsin is one of our great states in biomedical research, as you indicated, anchored in great academic institutions and entrepreneurial mindset. So I think it's a great example for the United States and many of our other states as well. When it comes to funding, these state-funded programs that oftentimes complement private capital, also oftentimes complement federal capital, are incredibly important. When you're starting a company, it's a very risky environment, and capital markets wax and wane. So oftentimes these state funds can provide the capital where there's either failures in the capital market or the technology is simply too early. And if you look at Wisconsin, some of the therapeutic areas that you alluded to that they're developing are areas where they have expertise coming out. And that's one of the things you see with many states. Not everybody's trying to do everything. Some are experts in cell and gene therapy, again, coming from their entrepreneurial base, coming from their academic institutions. So yes, I think these are incredibly important programs and a part of the ecosystem, but important to recognize the vast majority of capital that goes into drug development is private capital.
Yeah. In April of this year, and you referenced this report, Mr. Crowley, the National Security Commission on Emerging Biotechnology released an action plan with a number of recommendations regarding the future of the field. And the report aims to ensure that the United States remains the global leader. We've seen this playbook before with China. They make a sector a strategic priority, and it can achieve global dominance in that space if left unchecked. We cannot let that happen with biotechnology, which is so critical to our public health and economic strength and national security, and for the moms and dads with children that they love so much. So can you expand upon the dangers of losing our global leadership within role within biotechnology? What would a world where China leads in biotechnology look like?
I think it would be a very different world from the one we have today for the health and safety of our entire population. We need access to our medicines, so we need to think about where are they made. At the end of the day, Senator, I don't care where my kids' or grandkids' toys are made. I really care where our medicines are made. So we need to act with great urgency, as Senator Kim said, to look at biomanufacturing. Where are we making our medicines? How are they distributed? And ultimately, where is the research and development coming from? So this is incredibly important. We must win in biotechnology. We have the lead today. If we don't continue to act, it'll be a very different world.
Thank you.